is the debate over changing the childhood schedule. The hepatitis B vaccine on the schedule is given to newborns. What is the medical, scientific reason and proof for giving a newborn a hepatitis B vaccine if the mom is Hep B negative? Then you let this hepatitis vaccine be at 1 day of age, be forced upon everybody. And all of a sudden, the moms and the grandmas never trust you because you're trying to force a vaccine that's not necessary at day one.
We give the hepatitis B vaccine to newborns because that is when humans are most vulnerable to hepatitis B. Yes, hepatitis B is normally transmitted through thick blood, semen, vaginal secretions. So yes, most people that contract hepatitis B, it is usually through sexual contact or from like IV drug use and sharing needles. These people always want to bring up, well, this baby's certainly not an IV drug user, and if the mother was negative, then why are we doing this? But we've already been here before. The reason that we're doing this is because of the research that was done in the 1980s and into the 1990s. The hepatitis B virus can survive for up to 7 days on surfaces. So let's just do a couple of thought experiments. Let's say that mom gets her first trimester hepatitis B test and she's negative. What if mom gets a new sexual partner at some point during that pregnancy and then contracts hepatitis B, but doesn't realize that she's contracted it because oftentimes in adults it's actually asymptomatic. She's already been tested, she was negative before, so maybe she thinks she's fine, maybe it doesn't occur to her to test again. Or maybe grandma is helping out with baby at home. What if grandma has hepatitis B without realizing it? Grandma's cutting up fruits for snacks when baby is old enough, cuts herself, does not properly clean the area, baby comes into contact with that blood and contracts hepatitis B. You might be sitting there saying, well, that's so far-fetched, like those things are not going to happen. But the fact is that they do, and the consequences of babies not being protected from hepatitis B are enormous. 90% of babies that contract hepatitis B will go on to have a chronic infection. If you have a chronic hepatitis B infection, your liver is going to get damaged over time. You are at a much higher risk for things like cirrhosis, liver cancer. You might eventually need a liver transplant. You could die. 1 in 4 of those babies that get those chronic infections will die young. But they know this. They already know this. But they just keep trying to spin this narrative like people just pulled this recommendation out of their butts with nothing to support it whatsoever. All right, more to come. Stay tuned. If you found this helpful, please give me a like and a follow, and I will try to update you with more thoughts from this hearing today. See you later. Bye.